Hello, everyone, and welcome. We're so glad that you were able to join us today. My name is Elizabeth Holloway, and I serve on the ASOA Webinar Task Force. So we're very excited to bring you our topic today. I'm also fortunate today to have two roles in our webinar. I'm going to be your moderator, and Joe Theine and I will both present today's topic, Staff Compensation Plans. And this webinar is being sponsored by the ASCRS and ASOA. Before we begin, I have just a couple of announcements. I'm going to start with some instructions related to the technical components of your web browser. First, the slides are going to advance automatically throughout the presentation. If you wish to enlarge the slides, you can click the Enlarge Slides link located above your presentation window. And if you need technical assistance, there's a little question mark on the bottom left-hand side of your screen, and you can click on that link. If your screen freezes or the slides do not appear to be advancing as they should, you can press F5, that's Frank 5, on your computer keyboard to refresh your browser. And if that doesn't work, you can try exiting and restarting the session, as it could be an issue with your connectivity. Our webinar is being recorded today, and an email containing today's slides and the synced audio presentation are going to be sent out in about a week following the seminar today. And a copy of the slides and also a copy of a handout are available for download directly on your screen. We have allotted 1 hour for this webinar. The first 45 minutes, Joe and I will be sharing with you our presentation. And in the last 10 to 15 minutes, we are happy to address any questions that you might have. If you would like to submit a question, you can enter it at any time during the presentation through your Q&A box. So now that everyone is set on our logistics, we are so pleased to go ahead and get started. Before we do, Joe and I have our financial disclosure. Joe does not have any financial relationships to disclose. However, I work for BSM Consulting. When we started to put together this webinar, I was so excited that Joe would be able to join me today, and I just want to share with you all a little bit about his background. Joe is currently the practice administrator at Four Corners Eye Clinic, and they are a multi-specialty ophthalmology practice, and they're in Southwest Colorado. Joe is also the executive director for the Durango Network, a local independent 200 healthcare provider network. He is currently an ASOA board member, and he has served on several ASOA committees and lobbied in Washington, D.C. His previous experiences include many years in the pharmaceutical industry, several years managing physician revenue cycle and outpatient practices, and as the executive director for a local public health agency. Joe earned his Bachelor of Science degree in exercise physiology with an emphasis in sports medicine from the University of Puget Sound, and he completed his MBA in healthcare administration at Regis University. To briefly share with you a little bit about my background, if I haven't gotten to meet you before, I'm Elizabeth, and I've been with BSM now since 2013. I'm based out of Trinity, Florida, and I provide support to BSM corporate clients in all aspects of clinical operations, staff hiring, training and development, and human resources. Before I joined BSM, I also ran a large multi-subspecialty ophthalmology practice in the Tampa Bay, Florida area. So I do understand the firsthand challenges that administrators and managers face in their clinics. So Joe and I have gotten together and we've put some stories to share about our practices and really how we have managed this topic, staff compensation plans. So we're going to move forward now with our session objectives. And the first thing we'll do today is review our staff compensation philosophies. And a compensation philosophy is really answering the questions: why should we come up with a formalized way to look at our compensation and benefits? And then how are we going to approach this topic within our practices? Joe and I have assembled several resources for us to talk about in regards to the process to gather salary data. And then we'll also spend a little bit of time talking about an analysis for practice benefits and some of the trends that we're seeing in regards to employee benefits in general. And then once you have your compensation philosophy, what are some things to think about as you're going to be rolling out that new plan for your practice? And then that important piece of it is, what does that communication look like with your employees? So during our webinar today, we're actually going to be using Joe's practice as a case study. So I'm going to have him introduce his practice and share with us a little bit about why and how he developed his compensation philosophy.
Great. Well, thanks, Elizabeth, for teeing us up and getting us started with a great overview. First, I'll just share with you a little bit about our practice and then how we got started in really formalizing a compensation plan for our employees. So as Elizabeth mentioned earlier, we're a multi-specialty ophthalmology practice. We have 4 physicians across several different specialties, about 25 staff, and 2 of the 4 physicians are owners and 2 are currently employed by the practice. I've been with the practice for about 5 years, and when I first started 5 years ago, the owners in bringing someone into a practice administrator role had a number of objectives that they wanted to achieve. And one of those was to really help them step away from some of the day-to-day personnel decisions that need to be made by any business. And so it started us down a road in a discussion about how we might approach compensation. And if you can advance to the next slide, that would be great. So we had to answer some questions for ourselves about why we would want to develop a compensation plan. And from an ownership level, one of the early conversations that we had really centered around an idea of being fair and really being fair to 2 audiences. The owners didn't have a sense of what wages ought to be for their staff. They kind of had a history of what they had paid and just didn't have a sense of security about whether that was really fair to their employees. So they really wanted to go through some work to ensure that what we were compensating people for their time and their work and their talent was appropriate. And at the same time, we wanted to balance that and be fair to the owners and make sure that for all the risk and time that owners of a business take, in this case physicians, that they're also being properly rewarded and that we don't consume too much of our resources on compensation and then not have resources to invest in other parts of the business. And so we started down a path to really look at how we would balance those 2 things. And through that discussion, we wanted to be able to be viewed by our employees and by others as an employer of choice within the market that we serve. And that involves far more than just wages and compensation, but that's certainly a part of it, especially from our employees' perspective. So we started down a path to really look at what we would do for starting wages and then how we would grow employees' wages over time as they stayed with our practice. And again, from a strategic level, we got into conversations about what we would advance employees' pay for, how quickly we would advance pay, and we'll talk about that as we get a little further into our discussion today. But those were early parts of our conversation that really started to think about a compensation philosophy, not just what's an appropriate wage, and that's guided decisions over a number of years now. And then the other piece that became important for us was that the owners could have some confidence when they're looking at their staff and seeing how hard people are working, that they know that their compensation structure is in line with the values that they hold as owners, and that from an employee side that we could start to focus on other things other than just staff asking, wait a minute, how much am I going to be paid, or when's my next raise, or things that are important in an employee's life at work and what they take into their personal lives at home, but that we could start to really focus on other parts of the culture that we have for our employees and our patients that come into the practice. And at the end of the day, one of the most important reasons to have an overall compensation philosophy and to really work on developing a compensation structure is to retain employees. At the end of the day, we want to build a great team and we want people to stay with us as an employer, and there's so much we can do if we have a good employee retention. And so as we talk about things today, we always want to have an eye towards having employees that make a choice to stay with us. And compensation is certainly one piece of why we choose to work where we do. We want to recognize there's lots of other reasons why people choose to stay where they work, but wages and compensation are certainly an important piece of that conversation.
So as Joe mentioned, it can be a very effective tool in regards to employee retention, but having a competitive compensation philosophy and compensation plan within your practice is also really important to be able to attract new employees within the job market. And I'm not sure, if you're feeling this in your practices, but I know that, the U.S. job market and the number of available applicants that are on the market right now is being compressed. And there are a couple of key reasons why that's happening. First of all, our unemployment rate is the lowest it has been in 18 years. It's 4.1%, and it hasn't been that since the year 2000. We also have seen month after month consecutive job growth, and in December 2017, we had 86 months of consecutive job growth. And then for us in our practices, we're not just competing in general, we're actually competing with other new jobs that are being created in physician offices. And in December 2017, in that 31-day time span, we had 25,000 plus new jobs in physician offices created. So all of those things are really leading us to have to take a look and see, what are going to be our beginning wages, what are our benefits, because we're also seeing, for all of that being said, we're not seeing a lot of employee turnover. If folks are currently in a job, they're relatively happy and they feel well compensated. This could change in the next couple of years, especially as folks realize that they have options. But for right now, we're not seeing a lot of employee turnover. In regards to the main components of developing your compensation philosophy, and Joe talked about wages and the important piece of being able to settle that question for employees. That's really that quintessential piece of it for employees, because it really drives their day-to-day and how they're able to live their lives. But some other components of this philosophy are questions surrounding part-time positions. Do you offer benefits to part-time workers? And if you do, what should those be? And at what point do you have them come into their benefits? Also, to Joe's point, really being able then to decide your target budget. What percentage of your collections do you all feel comfortable contributing to staff wages and benefits? I think more and more it's becoming important for employees also regarding their paid leave policy. Folks want to have time off to be able to enjoy with their families and to be able to live their lives. And so that's increasingly becoming an area of focus. And then, of course, health benefits. Do we offer them? Do we not? If we do we offer medical, dental, vision, and how much does our practice contribute to those particular areas? And then in addition to those, there's some kind of the what I would call the bonus or the additional items to consider. Really identifying, are we going to have an incentive plan? Will we offer bonuses? And how will we decide that? If it's been arbitrary, throughout the years, perhaps now is the time to put something more formal in place when you go back to determine your practice's approach. We also look at the schedule for salary reviews and want to make sure that we're monitoring and watching what's happening in our local markets. And then our process to really review our total compensation plan for our practices.
So one of the things that we looked at as we were starting down this road, and we've continued to evaluate year after year, is what do we include in our total compensation package? And so when we look at that, we tend to look at not just wages, but we also look at benefits, as Elizabeth was describing. We look at retirement plan and have a 401k and a profit-sharing plan to share profits with our employees. We look at our PTO policy, the leave that employees have. We look at what we invest in professional development and continuing education, and all of those pieces really start to build that total compensation package. We also had to look at, philosophically, where do we want to be in the market that we serve, and we look at a couple different pieces, and I'd encourage folks to really define what your market is as you think about this. We look at our market as, one, what's happening nationally within ophthalmology. We want to make sure that we're having that total compensation piece reflect what's normal for our industry, but we also look at our local market. We're in a relatively rural environment, and often we're hiring staff that may not have a lot of experience in ophthalmology, and so we're trying to compete for employees that might be coming from other industries or other employers outside of the ophthalmology space. And so as Elizabeth was talking about unemployment and other national statistics, we keep an eye on what's happening locally, and our unemployment rate in our market's below 3% currently, and wage pressures are going up. We're in a state of Colorado where minimum wage laws have been updated recently, and we have minimum wages that are increasing serially year over year for the next several years, and that's going to impact the local wage market. So we had to define where we want to be relative to other employers in both of those markets. We had to look at what do we want a starting salary to be, and practices of different sizes will have different approaches to whether you just set a starting wage. You may have a step and ladder. You may have a very formal structure for how people progress through their career. As you saw, we're a relatively small employer, and so we chose to define a starting salary or wage for each position, assuming someone had no experience. And then we start to account for experiences that new employees bring to our practice and what we believe that will translate into performance, and then also look at other employees' wages and make sure there's some internal equity. But we did some work to look at our starting salary and try and set that from an ophthalmology perspective at a wage that would be around the 50th percentile. For some of the benchmarking data that's out there. So we've established that floor, and then there's some adjustments that we do over time. And so, again, thinking about what employees are thinking in their own minds once they've been hired and started working is they're trying to plan their life, and some of the questions they have, whether they ask or not, are, well, when might I get my first raise? What might that look like? How much might it be? And so part of us looking at total compensation is not just where do we start employees, but what things do we value and what things are we going to start rewarding people for in terms of pay. In our practice, we made some decisions that we wanted to move away from tying somebody's first wage to just time in the position. And so there was a time when the practice would say after 90 days, if you made it that 90 days, you would automatically get a pay increase. And we kind of walked backwards from that and said, gosh, we want to, if we're investing in this person and we believe that they're going to be a great part of our team, why wouldn't we pay them the best wage that we can pay from the very first day of employment and invest fully in them, not just in their training and development, but in the wage that they're going to receive as an employee here. And we value professional development. We value a number of things. And so for most of our employees, their first significant wage increase comes when they have a professional development milestone. And that's something we communicate from the very beginning of their employment. So they know for the position that they're in, if they make certain investments and demonstrate that in their development, that they can expect a certain increase in pay. and it also helps put them in the driver's seat for that. And then we also look at wages annually for all of our employees, and we have some thoughts around how we accelerate high-performing employees so that we internally differentiate our high-performing employees from those that are performing at maybe a different level.
Great. And I think, Joe and I are excited to share with you that as you're trying to think about where would we start our beginning employees and what would be some of the raises that should accompany some of those milestones, the exciting thing about ophthalmology is that we have great data. The industry has been benchmarking for a long time, and so we have lots of resources to look at together. Before we do start to pull salary data, there are a couple of items that we need to review before we get started. First of all, we want to go back and make sure that we have an updated job description for the positions we'll be looking at. Job descriptions tend to morph over time. Some employees will pick up responsibilities or lose responsibilities. And so when we are going to be comparing our employees to national or regional salary data, we want to make sure that we're comparing like positions to like positions. I also recommend completing an employee census by position. And what I mean by that is we're going to collate what everyone is currently making, and then we're going to categorize them by position. So you might put all of your technicians together. You might put your front office and reception together, or your billing team together, and that way you're able to understand sort of the overall range for the different positions within your practice. And then we like to look at the current salary ranges compared to your total payroll budget. So, if you moved into this direction and you were going to be looking at your increasing these salary ranges, what would that total payroll budget be? And then what was it prior to? What was your 2017 total payroll budget? And one other thing that I think is important to review in regards to setting your wage ranges is understanding your employee satisfaction surveys and the feedback that they've given you in regards to benefits. I know we all come from the standpoint of, I think everyone would love to make more money, sure, but I actually have administered employee satisfaction surveys, and the results coming back in regards to salary and benefits is, sure, I'd love to make more, but I think overall what I'm paid is pretty fair. And then they went on to give other points of feedback for the practice. So it doesn't always come back on a satisfaction survey in that it's a negative, but if employees are feeling that their wages are much lower for a particular satellite office or a particular position, or if there are some feelings of negativity regarding the benefits package, then that might be something that will also be important to review before you start looking at wages. So Joe and I brought forth a couple of tools and resources that we love to use. First of all, ASO Analytics, the staff salary survey module, is fantastic because it's constantly being updated by members. Folks are contributing to it, and it gives you the opportunity to compare your current practice with some of the national information out there. We also like to use the healthcare group's ASOA staff salary survey, and that comes in a book form. That's that blue icon there where it says year 2016, and that does get updated every year. I actually have the 2018 version sitting here on my desk. And then Academics and OOS with AAO also has a staff salary survey. And, I had asked Joe when we started our conversation, what he liked to use. And I'll let him share what he liked to use as well. But I really love to use all of these. And then I'll also pull open some Department of Labor information, sometimes the healthcare, sometimes MGMA. I'll take a look at that information as well. And I'm looking at MSA data, and that's the Metropolitan Statistical Area for a particular location, just to kind of understand if these wages are typically above or below national wages that we're taking a look at.
Yeah, and so we tend to look at similar data. When I first started, having worked in other healthcare environments, the first place I ran to was MGMA, just having familiarity with their data. And one of the things I quickly found was that within ophthalmology, that wasn't where, as an industry, we tend to put our data. And so the next place I found to be really helpful was the Healthcare Group Survey. It tended to have a pretty comprehensive view of ophthalmology and the positions that we have within our industry. And so that was very helpful. There were a couple of ways in which we defined positions here that didn't match exactly up with the healthcare group, so it wasn't perfect. And I like to look at more than one data source. I think there's a lot of value in doing that. And so not only did we look at that, but we kind of looked at at the time there were just some web-based surveys that were being done through other trade organizations or vendors within ophthalmology, and so we participated in a couple things and had 2 or 3 sets of data initially. We still look at the healthcare group survey every year. ASO Analytics has now got some data in there, and it has data for some positions that match better with how we describe job descriptions. So looking at both of those is helpful. Looking over multiple years is also helpful, and ASO Analytics has the now potentially 2 years worth of data sitting in one place. The other thing that we did was really, again, thinking about our market definition and the local market, was to really try and understand what was happening with local wage data. And having worked in healthcare in our community for some time, I had a good sense of what other local healthcare providers were paying for similar type work, and that was really important in making sure that what we were setting up for wages was going to be competitive locally. And then as time goes on and we're thinking about wage increases, and as wages in general are changing over time, are we keeping pace with those changes? We actually, I look for government entities that are publishing what they're doing for wage increases. So a lot of times the local cities and counties and other public entities will make public through their budgeting process what wage increases or what they're doing for benefits for their employees. And while it's not a perfect corollary to what all employers are doing, they happen to be some of the larger employers in our market, and so it really gives us a barometer for are we keeping pace, in addition to looking at those big national data sources.
Great. So if you haven't gotten to take a look at some of this information before, I thought I would just call out a couple of different components. I have for you just some snapshots of ASO Analytics is the top, and then the AAO online salary data is below, and those will also expand. But each of these surveys gives you an idea of, someone with no experience at all, so less than 2 years in the job. Maybe someone with medium experience, maybe 3 to 5 years in the job, and then someone who might be more of an expert or have seniority in that position that might be 6 or more years in the job. It also will always give you the population count, or the number of folks that have responded to the survey. It gives you the mean or the average for that particular wage, for that level of experience. And then ASOA gives you the 10th through the 90th percentile, and the AAO gives you the 25th through the 90th percentile. And if I could just encourage everyone to participate in these surveys as much as you possibly can. I know it takes some time to enter in data, but it's folks responding and entering and sharing information that allows us to really get great benchmarks for ophthalmology and for the different positions that we have. So in regards to reviewing the information and kind of putting it all together, I brought forward for you kind of how I try to organize the information. It might be an Excel spreadsheet, but I'm really, again, trying to match job descriptions. And in this example that I shared with you here on the screen, we're looking at the wages for a position called a technician manager. And of course, that could be a lot of different things just depending on your practice. So when we pulled data, we looked at the clinical manager, and that was from the ophthalmology healthcare group. We looked at another position called the head/lead technician manager/supervisor. And then to Joe's point, we looked at the MGMA, the clinical supervisor position. Again, just trying to get a sense as to what we were looking at. And so we selected salary data that we felt best matched this particular position for this practice. And then we were able to set a practice range. So I'm just going to reverse that for just a second, because take a moment and just look at the 25th percentile. Just go up and down that column there and look at how similar those numbers are. Now, I realize this is national information, so there might be some adjustment for your market, either up or down from here. However, when I'm trying to set a salary range and trying to come up with something that, again, we think is going to be fair for the practice and also fair for the employee, when I see salary data from multiple sources start to line up like this, it gives me a lot of confidence that we'll be coming up with a best solution for this particular position as technician manager. And so this group decided that they wanted to use the 25th percentile as their bottom, the 75th percentile as their top, and they had a compensation program, a bonus program that was going to kick people up into the 90th percentile or up into a higher percentile. And so they actually set theirs into the 45 or so thousand, all the way up to about 60,000. And then again, it still gave their employees room to grow within the scenario. We also recommend, again, in that employee census, I just gave you an example here, and I asked Joe to share with you a little bit, too, about how he organized his employee census that he used in an Excel spreadsheet.
Yeah, and if I showed you a spreadsheet, it wouldn't look exactly like this, but it had the same components on it. So we wanted to, one of our values was really rewarding high-performing employees who chose to stay here. And so we wanted to know not only what their current wage was, but how long they'd been working with us, how long they'd been in their current position. Because of professional milestones, we created some different wage scales based on certifications and other things that employees had achieved. So we also wanted to know when they achieved that certification or milestone in addition to their original date of hire. And then within similar employees, we wanted to be able to look at their wages to make sure that we had good internal equity. And so we wanted people to be paid fairly relative to other people doing similar work. But as importantly, one of the values that I mentioned we have is really high-performing employees who invest in their professional development. So the other thing that we look for is, are we differentiating wages? So we want there to be equity, and we don't want wages to be spread too far apart. But for those employees that really continuously invest in their development, and also some of the things that we measure within their work performance, and also how they uphold our core values, if they're consistently demonstrating those three things above and beyond kind of our day-to-day expectations, we want to make sure that that employee over time actually is paid more. And so by laying out a census like this, we get to start to make sure that our wages are actually living out the values that we state that we have.
Great. And then when you're setting your annual budget and trying to determine your payroll ratio, and we've now set our ranges and trying to understand how that's going to play in to our net collections and our overall budget for the practice. In order to calculate your payroll ratio, you are going to take your gross non-physician payroll, that's all your staff, minus all of your providers, just staff, and you're going to divide it by your net collections. And we define net collections as your gross collections less patient refunds. And that equation then is going to give you a range. Again, we have great ranges, great benchmarking in ophthalmology. Typically, an unburdened payroll ratio, so that's salaries only, are going to be between 20% and 26% of your overall net collection. So if you want to think about it in this way, for every dollar that the practice brings in regards to revenue, 25 cents or 20 to 26 cents are going to go to your unburdened wages for your staff. Then burdened wages is typically about 6% higher, and that also includes then the benefits that the practice offers. And so a typical benchmark range for an ophthalmology group is between 26% and 32%. In addition to talking about wages and analyzing those, we'll also spend some time analyzing our employee benefits. And I found this statistic. This was as of December 2017, but over a third of all organizations that have employees in 2017 increased their overall benefit offerings in that 12-month time period. And you can see there from your slide some of the categories. Wellness and health-related benefits were the ones that got the largest increase in regards to benefit offerings. And I can just share with you, too, that here at BSM, we also increased our benefits. We increased our PTO. We moved from a split plan of vacation and sick leave to one PTO bank. And then we also increased overall the amount of paid time off that our employees get to have. And we also this last year have implemented a new 401k plan within our organization. And so, those were some of the things that we felt were really important for our employees to be able to increase our benefits. So we have a poll next here that I'm hoping you all will participate with us. We're interested in understanding what percentage of the employee's health care premium does your practice cover. And so we are hoping that you'll be able to select what your practice currently offers and then hit the submit button for us. All right. Give everybody a couple of more minutes to go ahead and respond. All right, so it looks like we have 40% in the 75 to 99% range. A couple, 27% are at 100%, and then 27% at the 50 to 74%. So thank you all for sharing that. So in regards to developing your compensation plan rollout, again, we want to double check that there aren't some city-state regulations that we need to comply with. And your area might have a minimum wage that is higher than the salary data you might pull for national. And so you need to make sure that you're making adjustments there. Also, in regards to paid time off, there are many states and cities that if they haven't already implemented a sick leave policy that's required for employers to follow, they might be in discussions. So you just want to make sure that you're paying attention to what's happening in your local market, and you can make those adjustments as you need to. The other piece is that you want to sit down and review the plan with your owners and really discuss that the annual budget meets with their expectations and that they're going to approve spending the budget that you've outlined for them. And then, of course, there's deciding at what point you're going to set your wages for new employees and be able to make some decisions there. Also, to Joe's point, really establishing those guiding principles for wage increases. And then really, if you're starting this now and you're setting your baseline, increasing some of those lower salaries up as needed when you're going to go ahead and roll out your plan. And Joe, I'd love for you to share just a little bit about how you all did this in your practice.
Yeah, great question. So part of it goes back to setting an annual budget, and you talked a little bit about the payroll ratio and some of those things. So when we budgeted for the first years we were looking at compensation, we had a good sense of what our total investment would be and that we were comfortable with that. It was also great that we had looked at a lot of data sources because it gave us confidence that what we were doing was fair to both audiences, both our staff and to the physicians. And so as we rolled out changes, we didn't have a big fanfare. We didn't say, oh, we have this whole new compensation plan. In some cases, our philosophy and how we were paying matched up really appropriately with how many of our employees were being compensated. And in some cases, it didn't. And we had some individuals that were below what we had set for a floor. And so we brought them up to a level that we felt matched that internal equity piece that we were looking for, and also the performance they had demonstrated over time. And we handled each of those in kind of an individual conversation. But one of the things we did culturally was the physicians, as I mentioned early on our call, wanted to step away from that day-to-day. And so once we established an overall budget, an overall investment in wages, we didn't involve the owners or the physicians on decisions that were made about individual employee wages. That was done at a management level with the supervisors. And part of what that did was help us kind of start down a path where we expect employees to look to their supervisor for feedback on how they're doing their job, their day-to-day performance, for guidance and development professionally. And the supervisors have the mechanism to kind of get that direct feedback from physicians around things, but it really headed us down a path where from a management side, we're really empowering supervisors and their managers to manage the day-to-day activities for our employees, including wages and compensation. So that really got us started down that road for our staff. And then as we had some staff meetings and other things, and at opportune times when we were talking about total compensation, so when our benefit year came up, we started reinforcing total compensation. I think we're going to touch on how we communicate about total compensation here on the next slide, but we also took advantage of a particular time in year where we would communicate all of the compensation pieces that we felt the employee would value and that were being invested. And again, that was a time where we talk about our investment and our compensation philosophy with our employees. So while there wasn't a big fanfare and rollout, it's become woven into many parts of our dialogue with employees around their benefits and compensation.
Great. Thank you, Joe. And I put on the slide one of the handouts that you can download directly from the session today. This is an Excel document. It's the summary of employee wages and benefits. And I actually used this form in my practice. We actually met with folks to talk about their total compensation package twice a year. It was typically coinciding with a bonus distribution to the staff for our incentive program. But this, again, to Joe's point, helps them understand, we focus so much sometimes on that hourly wage or that annual salary, and yes, that is important. But I also think it is important to educate our teams that it's not just that. The practice has so many other expenses. And really, if we don't share that with them, it's tough for them to know some of that behind the scenes. And so we felt that it was important for them to really understand their total wages and benefits and what the practice paid on their behalf. So
some
in
of the things
regards,
go ahead.
Joe. I was just going to say, in regards to accelerated wages here, Joe came up with a great system here for accelerated wages, and he's going to kind of walk through that with us.
Yeah, and so I've talked on pieces of this. So we looked at when we're going to accelerate one of our employees' wages kind of faster than either on an annual basis or faster than other employees. When are the times that we're going to be intentional about doing that? And we share this with employees, like I said, as we weave other conversations throughout the year. And so one of the first things we wanted to do was really give our employees some ownership of their first wage increase. And so the first significant wage increase an employee will experience as a part of their work here is really around a professional development milestone. Typically, it's around a certification for our clinical staff or CPSS certification for our non-clinical staff. And we let people know as we're interviewing them and hiring that this is something we value and here's what they can expect. Some of the certification programs that we lean on to help us guide our staff are listed on the slide, and they're familiar to most of us. And then we also look at high performance in the role, and we do that in two ways. We look at kind of the technical aspects of their job description, what is their day-to-day work, but we also have a set of values that we ask our employees to exhibit in terms of how they do their work. So we look at both what is the work that you do, but how do you go about doing that, and how do you communicate and work with other staff and with our patients. And we accelerate people's wages as those behaviors are exhibited. And then we also look at tenure. We want employees who make a choice to work here and work here at a high level for a long period of time to experience wage growth. And so we both look at that throughout the year as we see things happening, but our annual review process that leads into wage changes on an annual basis also takes these pieces kind of into account. So at least once a year, we're taking a proactive opportunity to really accelerate people's wages that are performing at a high level.
Great. So we have another quiz for you, or another poll. If you would please answer, so how does your practice incentivize staff for achieving professional certification? A one-time bonus, a pay increase, a bonus and pay increase, or we do not provide incentives for certification? If you'll take a moment and just answer that for us. All right, we're getting some good responses for this one. Okay, so 85% of you are saying that you give your employees a pay increase when they achieve professional certification. That's great. Just in regards to additional considerations, I think I even saw one of these questions come through. What do you do with employees that are really at the top of the range? And Joe, I'll let you kind of answer what your practice did there.
Yeah, so we had an individual that had been with the practice for a considerable amount of time, and from a wage perspective, it really reached the top of a wage scale when we looked at a number of benchmarks. And over a few years, the benchmarks hadn't changed very much. So in the market, it appeared that the wage was relatively stable. And we didn't want to not reward that person, again, for the tenure, the time that they had spent with our practice. They were performing well in their job and had achieved some milestones professionally. And so for that employee, what's occurred year after year is instead of getting a percentage increase on their wage, they've gotten an annual bonus, and usually that's been paid out as a lump sum. And that bonus is varied. It's within the overall budget that we have for total wages. But we looked and have in essence said if this employee was going to get a 2%, 3%, or a 4% increase in their wage, what would that translate into a one-time bonus? And because they had invested so much of their time with us, years of service, we felt like we could pay that to them all at the very beginning of the year and trust that they were going to stay here through the end of the year, where other employees that are getting a wage increase, that wage increase is really spread out over the entire year because they're seeing it in each pay period. So it was a nice gesture to kind of value their tenure and pay it all on the front end, but also it was fair to the owners not to be continually increasing their pay beyond what would be normal for that position.
Great, thank you. And Joe, do you publish your salary ranges?
We don't publish it, so it's not sitting somewhere where the staff could go grab it and put their hands on it. We talk openly about what our floor is for somebody who's starting with no experience. So that is something that we make available. Because we're small and because we're constantly reacting and looking at benchmarks in the market, we don't actually sit down and say, here's our exact wage for someone who's been here so many years with so much experience. So we have that kind of sitting there as a guideline for us, but we don't publish that guideline.
Okay, great. So you might be thinking, okay, how do I get started now? You really want to go through the components that we've outlined for you here today and analyze your practice. Do you all have a compensation philosophy, and is it outlined very clearly for you? Do you have job descriptions? And really start to kind of check the boxes as to what you currently do have or don't have, and then begin filling in the gaps and being able to sit down with your physicians and come up with a really good assessment as to whether or not you need to alter or update your staff compensation philosophy. So really, in summary then, we just encourage everyone to take some time and look at your compensation philosophy. Take time to gain approval and consensus from your owners, your physicians. Really watch staff wages and benefits. It's kind of an ongoing thing forever. And then really figure out what's going to be the best mechanism for your particular practice on how you're going to communicate that philosophy with staff. So we have just a couple of minutes now where Joe and I will be able to answer some questions for you. And I'm going to go ahead and pull some of these over and start asking them. If you do have questions, you can go ahead and send them in for us. So number one, Rick here has asked, what is the average percent spread between starting salary and top of the range? And Joe, I don't know if you know that for your practice specifically. Have you set a specific percentage range there?
I can't answer it in terms of the percentage change. It varies a little bit by position, I imagine, but we tend to start our staff around the 50th percentile if they're new with no experience for that position. And we tend to view the top of our range around the 90th percentile. We try and race people who are performing well and meeting our values to the 75th percentile, and by race I mean over their first few years employed here. And then we tend to start slowing down, all things being equal, their increases up to the 90th percentile. So hopefully that gives some sense of how we approach kind of the starting and ending point for a range.
Okay, great. And then Josh asks, since there is an upward pressure on wages, how do you handle existing staff salaries when your new hires are having to come in at a higher rate?
Yeah, that's a great question, and I imagine that happens to all of us at some point. I can think of one individual who had been here for a period of time, and wage pressure for that entry-level position was pushing it up. And so we went back to that individual who we were starting to see some internal inequities occurring where newer employees were getting really close to her wage or even at or above it. And in a one-off, we made sure that we had a conversation with her about changing her wage, increasing it. We were very transparent about why we were doing this and letting the individual know that while she was performing really well in her job, this was not about her performance. This was about a change in the market and our responsibility to all of our employees to live out our values for wages. And in this case, it meant a change for her. And it didn't get in the way of us increasing her wage at appropriate times for her performance. So we didn't try and commingle those things. We made them very distinct wage changes and had very distinct conversations about why we were doing what we were doing.
Okay, great. Well, Joe, I just really appreciate you joining me today on our webinar. It's been a pleasure speaking with you. If anyone asked a question and we weren't able to take your question today, please know that the team at ASOA is going to gather your questions and make sure that Joe and I have the opportunity to respond back to you. So we will follow up beyond our webinar and be able to answer your questions at that time. Before we conclude today, I did just want to remind everybody that ASOA, or the Combined Ophthalmic Symposium for 2018, that registration is now open. The dates are August 24th through 26th in the beautiful city of Austin, Texas at the JW Marriott. And the Combined Ophthalmic Symposium provides education for the entire ophthalmic practice in one weekend. And it provides educational tracks for ophthalmologists, optometrists, practice management staff, nurses, and technicians. And so the website is there if you'd like to get some more information. I personally love these weekend programs because I feel like we can bring lots of staff that might not be able to get to the big meeting once a year, but they could maybe make a regional meeting like this. And I do find just a wonderful community and collaboration with administrators and physicians at these types of smaller meetings then on the regional level. So with that being said, Joe, again, I just thank you, and I just appreciate everything that you shared about your practice's compensation philosophy with us. I know everybody has to get to the office, but I do have one last important closing request. When you close out of the webinar, you're going to see a new window appear on your screen that's going to ask you for additional feedback. If you have any additional feedback or maybe a topic that you'd like covered on a future webinar, if you could please send that to us to help us improve our program so that we can have ideas and make sure that we're bringing programs that you will find valuable in your daily lives. So please take time to submit your comments there. And on behalf of Joe, ASCRS, and ASOA, and our webinar task force, we thank you so much for joining us, and this concludes today's webcast.